You mentioned habituation, which is kind of a gradual exposure to movement, but really in a more paced and gentle way to help the brain just kind of say, oh, okay, I can turn to the right, and maybe that doesn't have to feel so dizzy. Also, the research shows that sometimes, and people always get frustrated with me, but I'm like, no, it's not because you have like a psychological problem that you need psych support. It's because rewiring the brain is also like kind of a deliberate effort. So if I'm going to tell myself, okay, right doesn't equal dizzy, it's not just so easy as to say, oh, I'm just going to sell myself right doesn't equal dizzy, and that's going to work, because it's not really like an on-off switch, right? It's like we got to reshape the pathways here.
Yeah.
So, there's something called acceptance commitment therapy, or you can use cognitive behavioral therapy, the two kind of choices to reframe, and you're still shaping the brain. And that's why I think of both vestibular rehab and that kind of psych support type is you're trying to reshape the brain to, kind of tailor itself to no longer be afraid of movement. You mentioned that anxiety and fear of triggering symptoms is real and understandable. But
Sure.
of course, it can then reinforce symptoms. And so this is where we kind of get caught in a bad loop. So
Yeah.
we're trying to get out of that, right? So that's where that piece can be important for this group of patients.
So
And then
so don't
sometimes,
so so
because it's
so
the
don't
brain, we use medicine, and then we use like an antidepressant or some sort of SSRI, and that can help
mm,
shape the brain. So not every patient needs all three of those pieces, but sometimes we do. So we just need to kind of figure out for an individual, what do you need to
yeah.
help reshape your brain if you have 3PD, right?
So if you're really that anxious about it, you might need some meds to help you out. But at the end of the day, it sounds like what you might be saying is reminding us patients is the avoidant behavior actually isn't helping.
Yeah.
Like we kind of have to remember what it was that, and I used to say this before. I wish I knew what you were saying before, and I avoided a lot of stuff because I was afraid, and I still there's a piece of me in the back of my head that avoids certain things. I'm not gonna go on a roller coaster.
Fair. Again,
I
I
just
totally
I,
reasonable.
I want to go on a roller coaster with my kids, but I'm not gonna do it. Right.